Hi, it's Miss Delosier, and these are your notes on the joints of the skeletal system. And I would like to tell you that these are short notes because they're the joints and you learn them in middle school and probably in ninth grade also, but they're not. So I'm just going to start. Sorry. All right. So introduction to joints. So joints are kind of the functional junction. Functional junction. It's the spot where two bones meet and something happens, or doesn't happen, depending on the type of joint. They bind parts of the skeletal system together. They make bone growth possible. They permit parts of the skeleton to change shape during childbirth. Because if you think about it, like if there were no joints, if everything was just attached in one bone, like you would never be able to do anything or change shape or move, right? And they enable the body to move. That was the next part, right? Because they move when the muscle pulls on them. So that's it. So there are six types of joints that you need to know, like six specific types of joints. But before we do that, we have to talk about the structural classification of joints and the functional classification of joints. So first, there are three types of joints from a structural standpoint, like basically like what are they made of? So we have fibrous joints, which are basically sutures that hold bones together. We have cartilaginous joints where you have two bones that are separated by like a pad of cartilage. And then you have synovial joints, which are, when I said joints of the skeletal system, pretty much what all of you thought of, but they're super complicated and we're going to spend a whole slide on them after, like towards the end. So we're not going to waste time, but this is a synovial joint. See how much easier these are? Synovial joint, so much harder. Anyway, then there's three functions of joints. So joints can be synarthrotic, synarthrotic, which basically just means that they don't move, okay? So listen to me. Fibrous joints are generally immovable, synarthrotic. They don't move in general. I'm not promising you that all fibrous joints are synarthrotic, but most of them are. Then you have amphiarthrotic, which means slightly movable. You guys know frogs are amphipods, right? Right? Amphipods, right? Frogs, you know, like they can go in the water and out of the water, right? Amphibians, amphibians in the water, out of the water. So amphiarthrotic means they move a little, they don't move a little, they're slightly movable. So you have amphiarthrotic joints, and then you have diarthrotic joints, which are freely movable joints. So you classify them based on like what they physically look like and then how they move. That's it. All right. Fibrous joints. Fibrous joints are held together with dense connective tissues, primarily collagen fibers. And you find them between joints that are in close contact with one another. And there are three types of fibrous joints. There's syndesmosis joints, which are bound by a sheet of dense connective tissue, or a bundle of connective tissue. And so they can twist a little bit, but they're basically stable. And here's what I mean by they twist a little bit. Okay, so your tibia and your fibula, or your tibia and your fibula, your lower leg bones, right? Both of your lower leg bones are held together by this collagen tissue and it forms a joint, right? But like think about it, like how far and how much apart can your tibia and your fibula move, right? Like not very much, right? They're supposed to stay together. There's a little shifting, right? A little shifting, but there's not very much motion. They twist a little. They twist a little. The next type is a suture, and that is in black and not in white. And I don't know why, but it says suture right here in black. I'm sure you can't see it, but that is a suture. And sutures are between flat bones of the skull. And there's a thin layer of connective tissue that connects the bones together, and they are immovable. They don't move, which is good after they fuse together. Obviously, as babies develop, those plates haven't closed and they haven't fused together, but you don't really want your skull bones to move. And then the other one is gomphosis, which is a cone-shaped bony process in a socket, and it's a tooth, y'all. It's a tooth. Okay, so it's the joint between your tooth and your jawbone, and that is joined by a periodontal ligament right here, right? You see the periodontal ligaments right there, all the way around. Hold your tooth into the socket. That is an immovable joint, but those are fibrous joints held together by collagen. The next are cartilaginous joints, and cartilaginous joints are connected by hyaline cartilage or fibrocartilage, depending on the type of joint. There's two types. There's synchondrosis and symphysis. Symphysis, sorry, I'm struggling with all of the S-isis words tonight. So the synchondrosis are bands of hyaline cartilage and they unite bones. Some of them are temporary, such as like we talked about this at the epiphyseal plate, where you've got the ossification is gonna convert that and then make just that line. But you get some of this at the joint between the manubrium, which is this. So you've got your sternum, right? But your sternum has like a larger bone at the top, and that's called the manubrium. So the manubrium and the first ribs, right? So right there, between your manubrium and your first ribs, you get that bands of hyaline cartilage that hold the bones together. And then you have the symphysis, which is going to be a pad of fibrocartilage. Instead of bands, it's pads. And so these are probably the ones that if I'd asked you to point to a cartilaginous joint, you probably would have pointed towards the cartilage pads in your spine, right, between your vertebra. And so these are pads of cartilage between bones, and they're going to be articular surfaces, so surfaces of bones that move, that are covered with hyaline cartilage. They allow limited movement, and they kind of act as cushions, but also provide some flexibility. So there's one that's a fibrocartilage disc of the pubis, so where the right and the left side of the pubis meet together. There's a fibrocartilage disc, and this allows in women for childbirth, and then it also allows for the flexion in your spine, right? And so those are important. Next, synovial joints. Okay, so you guys are going to do a project on a synovial joint. It's a major grade. You're going to have to build a model of a synovial joint. Most joints in the body are synovial joints. All of them are diarthrotic, which just means that they're freely movable. So you need to know the basic structure of the synovial joint just in general, and then you're going to have to look up the specific structure of the synovial joint that you select. So basically, you're going to have articular cartilage that's going to cover the end of the long bone, because synovial joints are long bones. So you're going to have articular cartilage that covers the end of the long bone, and then you're going to have a joint capsule. So the joint capsule is going to be kind of this whole area, right? And within the joint capsule, you're going to have two layers. You're going to have a outer fibrous layer, and then you're going to have an inner layer, which is going to have a synovial membrane, which is going to secrete synovial fluid, which is going to basically provide lubrication for the joint. So here's a better picture. So the synovial joints are more complex, right? But they do allow more movement. So again, we've got articular cartilage, we have our joint capsule, right? The joint capsule. We have the ligaments, these white things are going to hold the bones together. You have the synovial membrane, which is the blue thing right here. And then the synovial cavity is, well, the cavity is the space in between. The blue, the light blue, is actually the synovial fluid, which is actually like filling the cavity, because fluids fill the space that they're in, right? So you've got your fibrous capsule, you have your synovial membrane, you have ligaments connecting the two bones together, And then in some bones, you're going to have a meniscus, and some bones, you're going to have a bursa. It kind of is going to depend on which joint you choose. So I'm going to let you go ahead and figure that out because there's going to be like a little sheet where you fill out like what you specifically need to put in your project, and that's just going to be research for you. So more general structure. This is a specific diagram of a knee, and it's showing specifically the synovial joint found in the knee. So you have your femur, and then this is actually your tibia, which is the larger shin bone. And then you've got your patellar bone right there. And so you're going to have you can see that you've got synovial fluid going all the way up here. This is the suprapatellar above the patella bursa, which is just like a little space filled with the fluid, right? And then and then you've got extra fluid spaces because this is a more complex bone, right? And you've got subpatellar fat, yellow adipose tissue, right? It's providing some cushion there. But you can see the synovial fluid goes all the way between the bones. You've got all this cartilage in here. If you've ever heard someone say they've torn a meniscus, this is what they've torn right there. If you know anyone with runner's knee, right? Runner's knee is the cartilage on the back part of the patella gets rough from too much friction between the patella and the long bones of the leg, and then when you are running for long periods or long distances, or actually jumping a lot of the time does it, the rough cartilage kind of creates like a weird friction when the knee moves, and it becomes inflamed and it hurts. So there are 6 types of synovial joints, and they're classified by their shape, their movement, and like the movement they allow. So there's a ball and socket joint. A ball and socket joint is also called a spheroidal joint. You're never going to see it called that. It's just a ball and socket joint. So you basically have a round head that sits within a cup-shaped socket, and it provides the widest range of motion. Your shoulder is a ball and socket joint. Your hip is a ball and socket joint too. I'm not going to do that with my hip. That would be painful. Then you have a condylar joint, which is also called an ellipsoidal joint. And it's an oval shaped joint, and it kind of moves. Here, I'll show you. It goes back and forth, and it goes like that too. Right? Right? But it does not rotate. There's no rotation. It doesn't rotate. I mean, I can rotate the flesh on my fingers, but not that. So this joint here, this knuckle joint, that's a condylar joint. Plane joint. A plane joint is also kind of called a gliding joint, and you'll actually see it referred to most of the time as a gliding joint. I'm probably going to call it a gliding joint. They're almost flat, but can be slightly curved, and they allow a back and forth and twisting movement. And so, like these bones in your hand are gliding joints. They do not allow any kind of non-axial movement, or they do. Well, so they just kind of move around, you guys. That's just a gliding joint. So they move, they kind of twist, like you can twist parts of them. I mean, it's hard to do with your hand, right? But there's non-axial movement. So they move in multiple directions, but they're not as freely moving as the ball and socket joint, right? Hinge joints, elbows, these are hinge joints, and they only allow one type of movement. Like I can't bend my fingers back in the other direction. That would be gross. That would cause a fracture. Pivot joint, pivot joint, pivot joint, pivot, atlas, and axis. Atlas, axis, atlas. Well, this is my clavicle, but the atlas sits on top of the axis. And you have cylindrical surfaces and they rotate. You have a ring that actually rotates on another bone, and it's uniaxial movement. So it's only rotation, that's it. And so it's your cervical, your first cervical vertebra and your second cervical vertebra directly below your skull. The last one, is it the last one? The last one? Yeah, the last one is a saddle joint. Saddle joint is right here. And it is the bones, both bones have concave and convex surfaces. So see here, it looks like this, right? And so it allows uniaxial movement in one plane. and it does this. Oh wait, sorry. I moved it. It allows, sorry, I was like, no, it doesn't. It's not uniaxial. Saddle joint allows biaxial movement in two planes. So you can go like that, right? Like biaxial movement. Okay. And so the carpal, it's why we have opposable thumbs, y'all. It's why we have opposable thumbs. Why I can do this. Saddle joint. Okay. Types of joint movement. So the synovial joints produce some really specific movement, and that's based on the muscles and their position. So there's a relatively fixed end of a skeletal muscle where the muscle attaches, and that is called the origin. And then that part of the muscle doesn't really move, but you have a more movable end of the skeletal muscle is called the insertion. And so basically what's going to happen is you've got the fixed part of the muscle contracts, it goes down to the insertion, and then it's going to cause that contraction and it pulls the insertion towards the origin. So if I flex my bicep, which is pathetic and wimpy, my arm gets pulled up, right? Because I'm pulling the insertion of my bicep back towards the origin of my bicep. So here are the types of joint movement very quickly, because these notes are ridiculously long already. So abduction would be like moving out. So like moving your leg out to the side is abduction. Adduction is pulling it back in. Lateral to the side flexion would be like bending at the side, right? But you could also have flexion and extension of your leg. So like you can flex your leg, you can flex your arm, you can extend your arm. You could hyperextend your arm. That'd be gross. Let's not do that, right? You can have dorsiflexion and plantar flexion. So that would be dorsiflexion is like pulling up your foot, and plantar flexion would be pointing like your foot, pointing your toes. You can have circumduction, which is rotation, right? You can have medial and lateral rotation. So medial rotation versus lateral rotation. Pull my arm in towards the front, pull my arm out towards the side. I can have supination, pronation, supination, pronation. Inversion and eversion is kind of supination and pronation of your feet. So inversion is rolling your foot out to the side. Eversion is rolling your foot in, kind of pigeon-toed. Protraction, retraction. Protraction, retraction. Elevation, depression. Elevation, depression, right? Okay, so replacing joints. I think this is the last slide. It might not be. I don't know, guys. So joints wear out, and I think you guys all know that, especially if you are carrying a lot of extra weight, or people that have had very hard demanding careers. Like a lot of football players are going to need joint replacement surgery. I actually know a ton of like elementary school teachers that need knee and hip replacement surgery, because think about it, in elementary school you had carpet time, right? And your teachers were constantly getting up and down off of that carpet, and they're not as young as a kindergartner. So a lot of people need knee and hip replacement. So we use synthetic materials to replace joints that are damaged by arthritis or injury. And typically those are going to be steel and titanium for larger joints, like a hip joint. And silicone can be used for smaller joints. Sometimes ceramic, not very often. The most common replacement surgery is a hip replacement surgery. So we have a lot of new technology, and they use materials that resemble natural body chemicals. So like a lot of them will coat the implants with that calcium phosphate material that is found in your bone. And then also you can like I mean, like you're going to see bones, but your bones don't all look exactly like that, right? Your bones are different sizes, they're slightly different shapes. So what they can do is they can actually use 3D printing technology to actually create custom replacement joints. So those replacement parts fit perfectly into the patient, which is pretty cool. So joint disorders. Oh yeah. this is important. So the difference between a sprain and arthritis and stuff like that. So a sprain is a tearing of the connective tissue within the joint, but it does not dislocate the bone. And the severity of a sprain is based on whether it's a partial or a complete tear. Bursitis is an inflammation of a bursa, which is one of those spaces where the synovial fluid is, and that's typically from overuse or stress. Arthritis is an inflammation or swelling of the joint, and there's different types of arthritis. You can have rheumatoid arthritis, which is an autoimmune disease where your immune system actually starts to attack parts of your body, so it's attacking your joints. You can have osteoarthritis, which is a degenerative, it's actually the most common type of arthritis. So as you get older, you start to get some inflammation caused by degeneration of the joint, and those are just like repetitive use, like wear and tear. And then you can actually have arthritis that is actually caused by a bacteria. So Lyme disease is a bacterial infection that was not treated in time, and you get the bacteria by being bit by a tick, and the tick passes the Lyme disease bacteria into your body, and it can actually lead to long-term arthritis in your joints caused by that bacterial infection. So stay away from ticks, and if you get a tick bite, you should maybe have the doctor check you out, because if you catch it, you can get rid of the bacteria before it causes Lyme disease arthritis.
Okay, so lifespan changes, take two. Sorry, my microphone died and my computer died. So as you get older, there's going to be changes to your skeletal system, and you need to be aware of them in general. So the first change is that you're going to have an increase in the stiffness in your joints, and that's kind of happens at an early age. So that tends to start happening to most people around middle age. And then over time, that can develop into arthritis as you age, typically osteoarthritis. So as you age, the fibrous joints change first, and they can strengthen because over time, those collagen fibers can go ahead and grow more together and create like a more rigid fibrous joint between them. Then you're going to get cartilage in your movable joints stiffening, and cartilage in so all the cartilage in your synovial joints and in your cartilaginous joints starts to just lose elasticity and get stiffer, which is going to make your joints stiffer. Your ligaments also lose elasticity, so you're not as bendy and stretchy anymore. You get some changes in the cartilaginous joints in your vertebral column, which also diminishes some flexibility. And then as that flexibility diminishes, you start to actually lose water in the discs. And so those discs, much like your skin kind of deflates as you get older, those discs kind of deflate as you get older. And so people tend to shrink as they get older because the discs between their vertebra are actually thinner, and so you're not as tall. Your synovial joints lose function, and that's partially due to that stiffening of the articular cartilage, but then it's also due to the fact that the blood supply diminishes over time. There's less capillary blood supply, and so there's just fewer nutrients, and so the cells start to die off. And then just as you get older, people tend to be more sedentary, and so you are not using your joints as much, you're not exercising as much, and that's decreasing the amount of blood flow to your joints, and so your joints are getting less nutrients, and so that speeds up that stiffening. So if you want your joints to actually stay healthy, the secret to that is exercise and activity can go ahead and keep your joints functional for longer. I know that sounds counterintuitive, like you would think that exercise would wear your joints out, but it actually increases the longevity. So that's it. I hope that's helpful. If you have any questions, go ahead and make an appointment.